Okay. Hey, Nick, we get perfect timing. I have 2 stations set up in there.
Okay.
I have bleeding control and oxygen administration. They're going to take you their packet. Their name's already on it.
Okay.
They're gonna. There goes one of my freaking testing stations. You're gonna fill it out. This is their actual testing. If they fail anything, you just write it down, hand them their packet back. They fail it, mark it on there that they failed, hand it back to them. No big deal. Okay. So do 1 station of bleeding control, and then while they're in there, switch them over to oxygen administration.
Okay, so I'm good with one grade to the next.
Just 1 person.
Oh, okay.
Medical's open.
Everything's
Test on both right before I get another person.
If anyone needs medical.
Josh, hang on, because the person that just went to trauma is going to have to switch to medical because my
Okay.
ambulance just left. All right, so anybody watching, the first 51 seconds was a complete waste of your time. So what we're going to do is we're going to go over this. I'll try to work through it. And then we'll get more testers here. So you guys need to, I'm going to give you topics you need to know. I would suggest writing them down. I'll try to send out an email version of things you need to know as well. But I would suggest writing them down. So, you need to know how to calculate minute volume. Okay? Minute volume. This is 200 questions. There's a lot. That's why we're going to take a lot of time to cover it. So what 2 things do you need to multiply to calculate minute volume? What is the primary responsibility of an EMT? You need to know what the primary responsibility of an EMT is. And yes, these are going to be straight out of the test. I'm trying to set you guys up for success. So, you need to know the phases of an ambulance call. Okay, they had to leave. Both of them had to leave. Okay, sorry, I'll have to start over here in a minute. So you need to know the phases of an ambulance call. You need to know about lacerations, what causes lacerations, would a blunt trauma cause a laceration? No, it would not, okay? Gosh, I hate these, they do the double negatives, it drives me nuts. Which of the following is not true? So the other ones are true. I hate how they do that. Hey, my man. How are you? Good. Okay, so which of the following is not true? So that means everything is true but the correct answer, right? So they could be caused by blunt trauma. My apologies. Could a laceration mean there's something else going on behind the injury site? Yep. Okay. They could be caused by penetrating trauma. That's also true. So I really don't like this question. Do we know what a degloving injury is? Do you guys know what degloving is?
Pulls your skin.
It's where you
Pulls the skin back. Okay. That would not typically be called laceration. Okay. It's a different thing. Degloving pulls the skin back. Are you bored in there, Liggett? Somebody can go over there. I know. Somebody jump up and go over there and we'll... Well, that's why I'm videotaping
What's in there?
discussion, It's like I thought this out. Bleeding control. They're probably tired of facing the wall. Okay. As soon as Ben comes back, he didn't want to talk to me, so let's see. Lots of situations on this test. So, are you ready? Or are you still prepping, Ben?
Huh?
Are you ready? Or are you prepping,
Ready for what?
students?
I thought we weren't supposed to be here till 8.
I texted you and said if you could come in early, that'd be awesome. 7:45. If you can't, that's
I
fine.
did not get that message, but let me finish moving these boxes so
Sweet.
I can get Melinda her receipts.
That would be awesome.
What is it that you need me to do?
The A skill station, medical trauma, anything's fine. Medical's in the BC's bedroom, trauma's in the last bedroom. Either one's fine, whatever you want. Thank you. Lots of people in good moods tonight. Why is getting a good history important? Why does that help you? I want to know that. How does getting a history help you? How do we determine what's left and right on the patient? Is it from your point of view or the patient's point of view, and what's that called? So if you have a patient that has a complete occlusion of an artery, do you think he's going to get better with your medications? Or is he going to continue to have pain? What do you think? You guys can talk out loud. It's fine. Complete blockage of one of his arteries. Think that if we give him some nitro or something like that, that's going to make it better? Or do you think he's still going to be in a lot of pain? Yeah, we're not going to be able to fix a complete blockage in the field. If you pull off your gloves and find that your hands are itchy, what do you think's happened?
Allergic to latex?
Yeah, probably so. So if somebody's been involved in a motorcycle accident and they are shocky, what kind of shock do we think that might be? They're not bleeding. No, like what type of shock? Now, are they compensated or decompensated? Neurogenic, maybe. They might have a spinal cord injury. So know your types of shock is what I'm getting at. No neurogenic, distributive, cardiogenic, hypovolemic. Know your shocks. They're going to get hit. Remember distracting injuries? Distracting injuries are anything that distracts you from anything else that could be going on. So musculoskeletal injuries sometimes look really, really bad, but in reality, there's something bigger going on. What two gases do our chemoreceptors measure that tell us when to breathe?
Carbon dioxide and oxygen?
Yep. So high carbon dioxide or low oxygen for the normal person. Know what the stages of stress triad are. Which I've never heard of, so I hope it's in your book. Just being honest.
What's it called?
Stress triad.
What do we gotta know?
The
What it is?
stages of stress triad.
Sorry.
In particular, the third stage of stress triad. If someone is shot, but also has trauma that would require a backboard. What's important to look for in any shot patient?
Exit one.
Entrance and exit wounds. Very good. You're going to need to know what gangrene means? Have you guys ever seen anybody with gangrene? Seriously? It is the most disgusting thing you'll ever see in your life. The last patient I ran with gangrene, oh my god. Every one of his fingers, the bones were sticking out, and the flesh had died back. So he had exposed bone ends, not wrapped with a bandage or anything like that. Just exposed nubs like sticking out. Both hands, both feet.
What is it called?
Gangrene. Yeah. He had a lot of medical problems. He died the other week. It was sad for him. But I actually was like, good for you. Like, it's probably best for him. Because, I mean, exposed bone ends, who wants to live like that? That's awful. No thanks, not this guy. What vessel, you need to know what the pulmonary artery and pulmonary, you know what the pulmonary artery is and which vessels carry oxygenated and which vessels carry deoxygenated blood. Okay? Does that make sense?
Mm-hmm.
Okay. Because we know it's strictly around the heart on what happens there. Need to know our normal respiratory rates for an adult. Pretty easy. We've been over that a million times. After you give a med, you gotta document the med and reassess the patient to make sure that they've had no changes, and then make sure you report it to a receiving facility. Some of these things I'm just telling you that are gonna be something you're questioned about, so I don't know. There's no way for me to review it other than to kind of throw it at you. With geriatric patients, with pediatric patients, what is different about their airway?
Are they diaphragmatic fingers?
What do you say?
What's different with it? Their tongue's bigger.
Big freaking tongues?
Yeah.
Yes, very good. And what is that tongue going to do? Block their airway. You need to know what hypertrophy is? Hypertrophy, like a trophy, like this is my trophy for being an excellent educator. Yeah, I don't know. Had a lot of coffee today. You need to know what happens during expiration. You need to know what the carina is.
And what was the last one you said?
What the carina is. Some of these questions are just... Some good signs that you have a tension pneumothorax would include distended neck veins, shortness of breath, and signs of shock, okay? Those are all good signs of a tension pneumothorax. So if there was a bad sign, it's not one of those.
You said what? JVD and
Distended neck veins, shortness of breath, and signs of shock. Good signs of a tension pneumothorax. Somebody want to go ahead and? Okay. I know like half of you are going to be tempted not to do any skills tonight because you want to get your review, but that's why I'm recording it, so you can still get it. Do you think ambulance operators tend to speed if they're experienced, inexperienced, younger, or private employees? What, inexperienced typically speed more. What's it called when you make a false statement in a report?
Sorry.
What is the appropriate terminology? It does start with an L.
Libel.
Libel. Or libel.
Libel.
How do you think most patients enter a hospital?
live.
Okay, that's not what I meant. What department do most patients?
Oh,
Yeah.
ER.
Yep. The ED. Yep. You need to know what a multi-system trauma is. You need to know what aerobic and anaerobic metabolism is, or are. You need to know how to ventilate an infant. What helps to make air go in and out of an infant?
Is that the, like, the towel?
Under their shoulders, yep. You need to know the normal rate to ventilate a child at. Why do we do a primary assessment? What do you guys think?
To see if they're deteriorating. Oh, no, I'm just thinking vitals.
Major life injuries.
Yeah, we're checking for major life injuries, life-threatening problems. That's the whole reason we do that primary assessment. Somebody just has some angina. What typically makes that better? Rest. Good. Good job. So let's say you accidentally cut yourself on a call. When you look down, you see your hand is covered in blood. You wash your hands thoroughly. What should you do next?
Report it.
Report it. Absolutely. Methods of decontamination that we do. That could include terribly worded question. Absorption, dilution, or isolation, but we're not typically going to be able to neutralize the subject in a pre-hospital setting. Pretty much giving you guys that answer, so we cannot neutralize in a pre-hospital activity. Terrible question. Need to know what the proper lifting technique is called? Do we need the patient's consent to restrain a patient if we're forced to restrain a patient? No, probably not. Probably not.
Please tell me.
We wondered about their personal life with that one.
You guys should know that. Need to know what an urgent move is, and when we do an urgent move. We're talking about extricating somebody from a car. Urgent move. Need to know when you would look at an ERG, Emergency Response Guidebook. The orange books we talked about during the hazmat section.
What is it called? Sorry.
ERG, or Emergency Response Guidebook. Need to know what kind of gear you would use if you went into a hazmat zone to treat a patient, which none of you are trained to do, but you have to know. So, you need to know what stridor sounds like, or how to describe stridor.
Is that one the high-pitched?
High-pitched upper airway. Yeah. You need to know when you're allowed to share information about a patient. And pretty much that is when you're talking to somebody else involved in their health care. Okay? Is COPD what kind of disease is COPD? Is it acquired? Is it congenital? Is it both acquired or congenital? What do you think?
You can get it from smoking.
You can get it from smoking.
Aren't some people born with
I don't know, are they?
Oh, no, it's acquired.
Yes, it's an acquired disease. It's not something you're born with. You see any babies walking around hacking?
Sometimes not enough.
And even if they were, it's probably because mama smoked. Okay, so it wasn't genetics. That was something they acquired due to somebody else.
And it's playing alright. What even with an infant at again?
An infant? The question was a child. A child was 12.
20.
Yeah. Infant's probably 26, but I want to double check to make sure this agrees.
Because we were having a conversation about this the other day.
Yeah. You need to know what a flail chest is. You need to know some legal terms like scope of practice, what protocols are.
What is
Protocols. You need to know what you would do with somebody who is pregnant that is having contractions 5 minutes apart. What would be your priority in that situation?
Delivered.
5 minutes apart.
No.
Getting them to the hospital is our priority, okay? If their contractions are 1 to 2 minutes apart, we're going to be looking at imminent delivery, okay? Would you ever tape anything in somebody's mouth? No, okay. Probably not. You need to know what syncope is. if somebody has dentures, what do we do? We're trying to bag somebody with dentures. What would we do?
If they're secure, you leave them.
If you're doing fine, you leave them there. If they're causing a problem, you take them out. They give the face some structure. It makes it a little bit easier to bag. Are you ready to start? I would love you very much. I'll tell you what to do. Bedroom 1, the BC bedroom, medical. Who needs medical? Mr. Schrader, come on up. I know you all need everything, so we're going to get everybody through something. I know, Funderburg said he needed a minute. If Andrew's ready, I'll take him immediately in cardiac arrest. Thanks. Actually, long bone, never mind. Just send him up here if he's ready. They're all mad at me because I'm in from earlier. Thanks. Can you do long bone and joint immobilization? It's testing, so long bone and then have do joint in my office. Yeah. It's already in there. I think everything. If you need anything else, let me know. But check it real quick and then come grab one. We're testing like these guys don't understand. They weren't ready for this. Apologize. I had you guys all come in early and I asked them if they could come in early, but they didn't understand like why we were coming in that early. Guess I didn't communicate well. Do you think EMS doesn't change? It's pretty much the same day in or day out, or do you think we're constantly evolving and changing based on research?
Constant.
Constantly evolving and changing. Things change every single day. You need to know what the spleen does. You need to know what the liver does. And the heart, obviously. You need to know what systolic blood pressure means. And by that, you ready?
I just need some triangle bandages.
Okay.
Do you have the sheets?
They have their sheets. They're going to bring you a packet with their name on it,
Oh,
and
we're
you're
gonna
going
sign
to
those.
sign it off if they pass.
If they pass.
Or mark if they fail. Just go ahead and mark it right on. Okay, so you need to know what systolic blood pressure is, what it actually means. So what the heart is doing during the systolic blood pressure. Okay? Something that you can see outwardly is called what?
Me too. Oh, son.
Two people, one will be a patient, one will be a, and then they switch. A sign, yeah.